Hello and welcome to another episode of Real Talk. I'm your host, Kiera. Today we'll have a guest on here, Miss Rosalind. She's going to give us the background and raise awareness on Alzheimer's and dementia. Please welcome our guest, Miss Rosalind.
Hi, thank you, Kiera. Glad to be here.
Rosalind. Thank you for coming to the show.
Thank you for having me.
Appreciate it. So, you are going to talk about dementia and
Yes.
Alzheimer's. Really a topic that I know for sure in the Black community that hardly anybody wants to talk about or even want to raise awareness or go to the doctor to find out and get diagnosed. Before we get there, tell us a little bit about yourself, Ms. Rosalind.
Well, thanks. I'd be happy to. I am a native of Colorado,
Okay.
and I went to Manual High School,
Oh,
go
okay.
Thunderbolts for those bolts out there. Married for 31 years to a beautiful man, and I have 3 beautiful daughters and 3 granddaughters.
Wow.
Yes, and graduate of University of Phoenix, a degree in business management.
Nice.
And I'm working on my graduate studies in healthcare leadership at University College.
That's good.
So I'm blessed. I'm a deaconess at Rising Star Missionary Baptist
Okay.
Church. And I've worked for the Alzheimer's Association for 1 year now.
Good.
I've been in health education for about 5 years. And prior to that, I worked for a telecommunications company for Sprint and Time Warner.
Nice.
So I decided that I wanted to get into health education to, like you said, raise the awareness and just help others who are suffering from this horrible disease.
Almost definitely. So I would ask, how does dementia play a role in your life? What makes you want to raise awareness?
That's a powerful question. First, let me say, as far as what is dementia, dementia is a general term for a variety of conditions and symptoms. So it's multiple symptoms that a person could have. And so that general term actually affects memory, thinking, and behavior.
Right.
And Alzheimer's disease is the most common form of dementia. So dementia is not a disease. It's a condition that's related to a variety of diseases.
Okay.
If that makes sense.
Definitely does.
And so in terms of how it plays a role in my life, I've actually had family members diagnosed. And in Colorado alone, there are 72,000 people living with dementia or Alzheimer's.
Wow.
In the nation, there's an estimated 5.4 million people living with it, which is, it's a public health crisis.
Right.
Which is really real talk.
Right.
Yeah.
Without a doubt. Well, normally it's noted that most people that are diagnosed with Alzheimer's or dementia, or Alzheimer's, if you will, are elderly people. But what is the noted earliest age you've heard of somebody that's not as elderly, 65 or older, that has been diagnosed?
Well, because Alzheimer's is a progressive brain disease that literally kills the brain cells and unfortunately is fatal. It is true that age is the primary risk factor. However, there have been some as early as in their 30s or 40s that have been diagnosed with the disease.
Wow.
And that's called younger onset, which is fairly rare. It's about 5% of cases of younger onset.
Okay.
Typically, it's 1 out of 8 people ages 65 or over who have been diagnosed. Women are living longer, so if a woman is 85 or over, it's about 50 cases of 50%.
50%.
Yeah.
Wow. That's a huge percent.
It is.
Now, to raise awareness, how do we go about that? That's what we
Well,
want to know here on Real Talk.
sure. What I do is go in the community. I go to churches, civic organizations, different places wherever I can go and get the opportunity to talk about it.
Right.
Talk about what the warning signs are, talk about our different programs and that sort of thing. So I do a professional presentation with, you know, laptop, a projector, and the whole nine, just to get the awareness out. So whatever it takes. In some cases, I will do a health exhibit.
Right.
So at health fairs, I'll have literature like materials that I actually brought here today to share with people in the community to increase the awareness.
That's really amazing. Now, what are some of those warning signs and symptoms?
Excellent. The first warning sign is memory loss that affects or disrupts daily living. So, for example, a person's not able to retain recently learned information.
Right.
And with that, it affects them every day. Or they may ask a variety of questions over and over. That's one sign. Another is poor judgment or problem solving. Also confusion, anxiety, perhaps not participating in social activities like they used to.
Becoming an introvert.
Yeah, yeah. Or it could be signs of depression.
Yeah.
The bottom line is they need to see a doctor and talk to a doctor.
Most definitely.
If anyone notices it. So any new changes, basically, misplacing things and losing the ability to retrace them. Someone may accuse you of stealing something.
Yeah.
That's a
huge case there.
Yes.
I actually have a sister that works in the nursing home, and when I've talked to her, and she talks about how sad it feels, and you know, they'll have family members that come in, and you know, it's like, who stole my remote, and or somebody stole this from me, and I mean, you can just, the hurt that you just have from a family member just accusing you or just seeing them wither away.
Yes.
That's kind of, that's why we want to raise this awareness and make sure that if you have family members or if you have somebody close to you that has the symptoms that just briefly Ms. Rosalind has explained, that you go to see a doctor.
Absolutely.
And get diagnosed, because that's the best way of helping yourself is by getting that care and treatment.
Absolutely.
Were there any other signs and symptoms?
Others would be personality changes or even trouble with your vision or spatial relationships. A person in early stages of dementia, they may literally walk by a mirror and think it's someone else and not themselves. So, you know, those are devastating symptoms.
For sure.
And a person who notices something new within themselves, they may not be quick to want to share it.
Right.
Because they may be afraid or in denial. And so it may take a loved one to help that person.
Right.
To say, I notice something's different about you, you know, you're not doing the kind of things you used to do. Let's go see a doctor.
Right.
So it's important to write the symptoms down.
Now, as we may know, there is not a cure for dementia or even Alzheimer's, which is a form of dementia, right? But in some cases, there are things that we can take or precautions that we can take by, you know, not necessarily, I can't say not being diagnosed with it, but there's some level of precaution that we can take to kind of reverse levels of or stages of Alzheimer's?
Well, I understand what you're asking me, and with that, there are some dementias that are reversible. There are a variety of dementias. So Parkinson's disease is a dementia, Huntington's, which presents different symptoms. There's frontal temporal dementia, which is more of a personality change.
Right.
So there are a variety of dementias, but it's true that a person may show the signs of it. However, they may just have a urinary tract infection.
Wow.
Right. Something as simple as that could show up like a dementia.
Wow.
They may be deficient vitamin B12. That could be showing up like a dementia.
So the lack of.
The lack of.
Can show a form of it.
Yes.
Wow.
Thyroid problems is another one. So there are a variety of tests a doctor could do. It's important a person would see a neurologist or a neuropsychologist, someone who is familiar with dementia. All primary care physicians are not.
Right.
So that's very
That's when a
key.
specialist comes in.
Absolutely.
Now, are there any tactics when you're raising that awareness in the community that you give to if a family member is suffering from Alzheimer's or a form of dementia? Are there any tactics that you try to share with them to say, this is, as a caregiver, this is the precautions you should take and make sure you're taking care of yourself?
Oh, yes, absolutely. November, is National Alzheimer's Awareness Month. In addition, is Family Caregivers Month. So this is a month that we're really trying to heighten the awareness to caregivers on the importance of taking care of themselves. And with that, because stress is real,
Yes.
and as a caregiver, they have a tremendous responsibility. So, you know, it's important that they take care of themselves through physical activity, eating right, you know, certainly managing their own health.
Right.
Because as far as caring for a person with dementia, it's noted that normally the caregiver is the one that their health may decline faster than the person with dementia.
Wow.
So yes, we encourage communication tips. We have a 24-hour, 7-day-a-week helpline.
Yes, I've seen that.
Yes, and with that helpline, we have awesome trained counselors who will take the call and give the caller communication tips, encourage them to speak slower, give eye contact to the person with dementia, and give them respect and love and dignity. But certainly just make sure that they're not arguing, because you cannot reason with a person with dementia.
Certainly.
Their judgment is totally off.
Right.
So again, dementia affects memory, thinking, and behavior.
Right.
So it's important that you learn communication tips. And we have classes to teach people how to do that. We have a 6-week Savvy Caregiver class that will educate the caregiver. Excuse me. And then we have a variety of other programs.
Right.
Targeted for the caregiver.
So everything that we need is there. We just need to raise the awareness so everybody else can know that it's there and utilize what your association is trying to do in our community. Now, as I stated earlier, it is known that in the Black, African, and Latino community that we don't have the best awareness on any health, but definitely with Alzheimer's and several forms of dementia. So that's where you come in your association.
Yes.